Hi, this is Dr. Tom McFadden at Advanced Cosmetic Surgery here in Greenville, South Carolina, and today we're going to talk about brachioplasty. Brachioplasty is an arm operation. Some people call it an arm lift. It's really not lifting, it's removing extra tissue. Good candidates would be those who have extra skin, not so much extra fat, and there is some balance that has to be had between removing skin and removing fat. So a lot of people have both, and so both of those issues need to be addressed. The extra fat, if it's in the resected area, doesn't need to have additional liposuction. You can do just the brachioplasty. So the brachioplasty frequently is an incision. It's a pretty long incision, and it goes from the underarm area really along the chest wall into the armpit, and then down usually along the posterior border of the arm and across the elbow just into the forearm. You can see with my flabby skin that I need a little bit of a brachioplasty, but not too much. So brachioplasty is for people who want to get rid of that extra flabby arms, and understandably so. It's not a really difficult operation. Usually it takes a couple of hours, about an hour for each arm. It's just a lot of suturing, a lot of stitches. It's not particularly difficult. Probably the thing to worry about most with a brachioplasty is one of two things. One is there's a sensory nerve that comes out through the fascia and then provides sensation to the upper forearm. And then also, in trying to get the tightest possible contour, I always try to envision a pipe and try to tell people that we're looking for that pipe-like look. In trying to get them that tight, frequently you have to balance between getting it too tight and cutting off the circulation and then having it relax, several months later, which always, unfortunately, is inevitable. So the reason that people come in for brachioplasty is because they have loose skin and they have damaged and compromised tissue, and that's not something we can change as plastic surgeons. That's already done. It's in the bank. There's no going back. So the quality of the tissue doesn't change with the operation. It's just the amount of excess badness, if you will, that's removed. So people come in on the day of surgery. We go through the final questions. They've already had a preoperative visit, usually about 10 days to 2 weeks prior. We've made sure that everything is good as far as the medical history, and patients understand where to show up, what to do, what medications to take and not to take on that day. And so all of the logistics are all ironed out. You'll come in, we'll check you in with the anesthesia personnel, we'll get you ready, put in an IV. As I said, the operation takes about 2 hours, and then you'll be asleep during the entire time. We do general anesthesia here. You'll wake up, you'll have some burning as you would with any operation in the skin. The skin pain generally goes away pretty quickly within a couple of days. It's the deeper pain usually for most operations that lingers, and fortunately for this one, there's really not much in the way of deeper pain. So we do want you to stay pretty immobile. Keep the arms in tight. Don't raise your arms up very much. The downside of a brachioplasty is that it's the most unpredictable scar probably of any operation that we do in plastic surgery. The shoulder is the most mobile joint in the body. It can go in a variety of directions. This incision can be subject to a number of different stresses and tension lines. And the incision comes right across the elbow, and that is a flexion joint. So all of these things can lead to irregular scar formation with a brachioplasty. So scars are very unpredictable, and we just have to do the best we can in terms of keeping it immobile, minimizing that tension, and then hoping for the thinnest line possible. And if you do need a revision, we can revisit that down the road. To expand on recovery, we ask that patients wear a compression sleeve at least. Sometimes for women there's a bra that's incorporated with some sleeves. For men there can be a vest incorporated with the longer sleeves. And that helps massage, mold, and shape the arm. And it also massages the scar as well. We want you to wear that for about 6 weeks or until the swelling goes away, whichever takes longer. And that's generally when we get a pretty good idea of how the shape is eventually going to be. Wounds don't really heal all that well until maybe 6 or 12 months later, but we can get a pretty good idea maybe 6-8 weeks out from the surgery of how you're going to look. As far as the chances of revision, it's again very unpredictable. Some people need none and they heal beautifully, and it's amazing. And other people, they have thick scar most of the way, some of the way, intervals, good, bad, good, bad. If I knew how to figure that out, I wouldn't be doing this. But we certainly can reevaluate down the road whether or not some of those areas need to be revised, or if it's very mild, we can entertain some steroid injections for thick scars. If it's slight irregularity, we can even do laser blending, and that helps smooth out the contour. I think minimal activity afterwards and unfortunately pre-existing skin quality are the main factors that determine how good of a scar that you may have. So that's it on brachioplasty. I hope you enjoyed the video. Be sure to like and subscribe, and we'll see you soon on the next video. Thanks.